My name is Stephen Fine, Communications Director for the Nevada Cancer Coalition, and today I have the pleasure of talking to Dr. James Nachiondo with Gastroenterology Consultants here in Northern Nevada. Dr. Nachiondo is part of the GI Consultants medical team. He has been with the organization since 2005, and to add props, he's a native Nevadan from Winnemucca. So welcome, Dr. Nachiondo, and thank you for being with me today. Is there anything you'd like to say about yourself or GI Consultants as we get started?
Sure. Well, thank you for having me, Steve. I just want to say that this is a very important topic to me, obviously, as a gastroenterologist. I also speak from a place of empathy to patients, as I have personally undergone colonoscopy 3 times for screening. And I recall how anxious and really anxious I was prior to that first colonoscopy. I really thought it was unusual and I didn't expect it, but the staff who took care of me helped to calm my nerves and really helped me to understand that it's very normal to have anxiety prior to this procedure, and helped me to realize that I had made the right decision, that millions of people had come before me and had colonoscopies, and that colonoscopy is actually having an impact against this disease, which is quite preventable and also very treatable when it's caught early. So I just want to stress to patients that you're making the right decision, and it's normal to be anxious.
Let's start with some simple questions here. Let's say a patient has scheduled their colonoscopy. What can they expect prior to the actual screening?
Prior to the actual screening, they can expect to be given oral and written instructions, and I would certainly stress to patients the importance of trying to read those written instructions a full week prior to their colonoscopy. I think it helps to allay some of the anxiety that can come during the 24 to 72 hours before the procedure. If you feel prepared, you're in training for your colonoscopy, and it really does start a full week out. The patient will also be given a phone number that he or she can call with any problems or questions or concerns during the process of preparation for the colonoscopy. The patient will certainly be expected to consume a laxative preparation, and we've all heard all the horror stories and the jokes about this, but it's extremely important for the patient to do the best job that he or she can in getting cleaned out, and therefore getting the best tests that they can. Additionally, the patient is likely to be asked to alter their diet more than just the one day prior, which we all hear about, the clear liquids and all the Jello and the broth and the Gatorade, but they may be asked to avoid certain foods like seeds or nuts and things like that for up to a week before. Any daily medications that the patient takes will be looked at, and the patient may be asked to hold those for even up to 7 to 10 days. Examples would be oral iron or fish oils or vitamin E, which can sometimes make the preparation process more difficult or even thin the blood. Okay. And along those lines, patients who are on blood thinners will definitely need to discuss the management of those around the time of the procedure, the management with their provider. The patient will often be asked to hold those for a certain number of days before and potentially even after the procedure.
Okay. The prep is the hard part. So now that I'm done and I'm in the office, what can one expect when I show up for my screening procedure?
Right. Well, again, I would stress to you to come early, okay? You'll be asked to arrive most likely 1 to 2 hours before your scheduled procedure. And most of these procedures are done in outpatient endoscopy centers and occasionally at the hospital, typically as an outpatient, right? So when you arrive, you will meet a very nice person, hopefully at the front desk. And that person's job is literally to interact with people who are hungry, tired, and often quite anxious and maybe grumpy. So, I would stress you to be patient and as kind as possible to that person. that person will then proceed to ask you to do what seems like signing your life away, because you'll have to, sign documents, which might include HIPAA documents and updating history and, patient information forms. And these days, COVID informational forms as well. So, be prepared for that. Then when it's your turn, you'll likely be called back to the pre-procedure area, where nice nurses and endoscopy technicians will give you a funny looking gown to put on, and then proceed to place an IV in your arm. So I would stress to you to try to drink as much fluids as possible the day prior to the procedure, to increase the chances of successful IV placement with the first poke. These nurses and technicians don't want to traumatize patients who are already anxious by having to repeatedly poke them. So after you get your IV, you're likely to speak to your doctor, and your doctor will review the indication for the procedure, which in this case is colorectal cancer screening, and potential risks of the procedure, and then see if you have any more questions or whatnot. The doctor will examine you and review your history and look at your vital signs and make sure that everything is as safe as possible and perfect to proceed with your colonoscopy. Depending on the location and the type of sedation received, you might also meet an anesthetist or an anesthesiologist at this point in the pre-procedure area, who will also talk to you about your history and examine you and talk to you about the type of sedation that you might receive. And then you'll be brought back to the procedure area, which is often referred to as the endoscopy suite or the endoscopy room. And so this will be, a calm environment, typically with lots of foreign-looking equipment and things, and a big television monitor, which is where we are able to see what we need to see during the procedure. At that point, you'll be positioned, so you'll be on your left side with your knees gently bent. And I tell patients it's kind of like lying on your side on a chair. Pretend like you're sitting on a chair lying on your side. Then you'll get sedation administered. The sedation will typically be administered through an IV that has been placed in the vein. Depending on the type of sedation, you might be awake at times through the procedure. You probably will not remember that. Or you might literally sleep through the entire procedure. During the procedure, the physician will insert the colonoscope and then gently advance the colonoscope towards the end of the colon, also known as the large intestine, where it meets the small intestine. During this process, the physician will be instilling carbon dioxide, which will open up the bowel and make it safer and much easier to see anything like polyps or any other abnormalities in the colon. Upon withdrawal of the colonoscope, the physician will try to remove as much of the carbon dioxide as possible. The nice thing about carbon dioxide is that it is resorbable by the body, and this happens rather quickly. So some of the horror stories that we've heard in the past about people feeling quite bloated and gassy afterwards, that's a lot less of a problem nowadays, as advances have been made in our how we do the procedure and what we use to open up the bowel. Any polyps, and so a polyp is a growth. Think of it like a bump in the lining of the colon. Any polyps detected, the goal is to remove those polyps and send them off to the pathologist for analysis. So the pathologist will chop them up, look at them under the microscope, and then make a diagnosis as to what type of polyp we're dealing with. That helps the clinicians to then decide about appropriate recall or repeat times for colonoscopies. Anything else like redness or certainly tumors would be biopsied during this process. So the physician would use very tiny instruments, which can be inserted through the colonoscope to gather these tissue specimens. And usually the patient's not going to feel the process of taking a tissue specimen or removing a polyp because of the unique characteristics in the colon of really not having pain receptors like we do on our skin per se.
are there any changes in the procedures when someone wakes up? Because you're obviously not going to drive home after a colonoscopy because of your anesthesia. How is that? How can people best prepare for the post-procedure?
Yeah, good question, Steve. So first I'll address the impact of COVID-19 on colonoscopy and really any procedures occurring in ambulatory surgical centers. So at this point, you can expect that a lot of the staff working in these centers have received both doses of the available vaccinations. However, we continue to operate under the same sort of guidelines and protocols and procedures that were put into place early in the pandemic. So essentially, patients are screened as they enter the buildings or the hospital, as the case may be. And that's typically going to include a temperature check and a questionnaire relating to items such as travel, symptoms, or potential exposures to individuals with COVID. Many of the centers and hospitals are also requiring pre-procedure COVID testing via nasal swab, but not all. Once the patient is in the building, and the patient will be asked to wear a mask, upon entering the building and then throughout. Once the patient is having their procedure, the mask may be removed at times so that their procedural team, again, which might include the doctor, the nurse, the technician, an anesthetist or an anesthesiologist, all for you. It's a great big team taking care of you. But the patient may be asked to remove the mask at times so that we can monitor their breathing, monitor their airway, do things like insert airways, things like that that may be needed. But the vast majority of the time that the patient's anywhere in the center, they'll be wearing a mask, and all of the staff will be wearing masks at all times. Anyone who is in the procedural area is likely to be wearing an N95 mask. I speak for my practice in particular, and I think that everyone's taking this extremely seriously and doing the best job that we can. So in the recovery area, the patient will definitely have their mask put back on. Now, it might take a lot of reminding from their nurse or technician taking care of them in the recovery area to keep their mask on. But that's, we're used to that. We're used to reminding people not to touch their eyes, don't scratch their eyes. Don't get out of bed yet. No, you can't have coffee yet. You can't go to In-N-Out Burger yet. These sorts of things. So we're prepared to keep these people, wearing their masks too, the patients, and to keep them as safe as possible while they're in. I would just speak also to the fact that I think all of the centers, are trying to protect everyone through increased cleaning measures and through increased times between patients to allow things like air exchange in endoscopy suites, and through using caution to screen all employees every single day, at least once a day, in the same fashion that we screen our patients, and to send people home when they fail those screenings and things like that. So we really do want to make patients comfortable coming into an environment during the pandemic, with the understanding that that we're doing everything that we can to keep them safe, and always including protection from COVID.
That's really good to know. Following your procedure, and let's just say 1 to 24 hours later, do folks experience side effects? Do they need rest? And what's the typical time they can usually get back on their feet and go back to work?
Right. Well, I tell patients that they should be able to do their normal routine the next day, like almost always be able to do their normal routine, including work. And sometimes they might be a little disappointed to hear that, but usually they're happy to hear that. I tell them, I say, look, if you can't do your normal routine, then I want to know why. You'd better be calling me, or they're going to receive a phone call from my staff the next day anyhow, a check-in, and I want to know what's going on if they can't do their normal routine. But while they're still here in the center, during that 20 to 30 minute period, that it takes for them to wake up and be ready to get dressed and whatnot. And usually within an hour, they're ready to leave the center. And sometimes, again, depending on the setting with the COVID pandemic and whatnot, usually the patient's going to be allowed to have their chaperone, their driver, which is mandatory. I'll stress that too at this point. You have to have a driver. That's not negotiable. That's like law. So usually we'll allow the chaperone to be in recovery area with them, to be another set of eyes and ears as we provide them information. So the team, including the nurse, technician, and doctor, are going to provide oral and written information regarding things to look out for, signs and symptoms to look out for, not only during the first 24 to 48 hours, but also up to a couple of weeks later, because sometimes depending upon the details of the procedure, such as polypectomy, removal of a polyp, the patient may have some degree of risk for bleeding out to a couple of weeks. But, for the first 24 to 48 hours, we tell the patients to look out for things like bleeding, okay? That is more than any sort of, small volume intermittent rectal bleeding that people might have at times, or fever, or abdominal pain. And especially if these symptoms are not just transient and temporary, but if they're mounting and worsening, and that's the course, then they'll need to call right away. And there's always a physician available to handle these calls. The patient might speak to a nurse or a technician first, but input from a physician is readily available through our centers at all times. We tell the patients that they may not have their first bowel movement after a colonoscopy for up to 2 or 3 days, and that's not unusual. So, when you think about it, you've cleansed your bowel entirely, so it may take a little time. And we tell patients that if they have any questions or concerns at all, just go ahead and call. Don't feel like you're asking a ridiculous question at any point. We've heard it all. We won't laugh at you.
Wonderful. That's great to know. That really is good to know. Is there anything that differs in a colonoscopy for someone who has previously had colorectal cancer?
That's an excellent question. I would say that the first thing I would say is that there's likely to be a degree of anxiety that might not be there for someone who doesn't have a previous diagnosis of colorectal cancer. That person has already been through the process of being told after a procedure, hey, you have cancer, or I think you have cancer. I've been doing this for 20 years and I've seen these, and we have to wait for the pathology, but I think you have cancer. So there's going to be a degree almost of post-traumatic stress disorder there coming into a colonoscopy. Otherwise, I would say the interval, from that first colonoscopy when the patient was diagnosed with colorectal cancer might differ from, say, the person who comes in for their screening colonoscopy at 45 or 50 years of age, has a normal colonoscopy with an excellent preparation and is told to come back in 10 years. The person who has a history of colon cancer is not likely to be told to come back in 10 years. Right. It's more than likely going to be like 6 months to 1 year at first, and then maybe 3 years after that, and then maybe every 5 years long term, things like that. But otherwise, that patient's likely to go through the same process of preparation, possible alterations to diet and medications and things like that. We're probably going to be keeping a broader team sort of in the loop. That patient who's had colon cancer is probably going to have an oncologist and maybe a surgeon and so on and so forth. So I'll be copying my notes to more appropriate people. I'll also be talking to that patient about their family, about their first degree relatives in particular. So, their parents, their siblings, and their kids, because those people are likely to be at higher than average risk at that point, and I'm going to be interested in educating all of them. It's important for the patient to understand that they're really expected to take it easy for the rest of the day after their colonoscopy. The patient might feel like they're of sound mind and feel like it's okay to work, but we strongly discourage this. The person's judgment is likely impaired. Also, we discourage driving strictly, as well as operating heavy equipment, drinking any alcohol, or really making any important decisions, including financial decisions. That's not the day to go and buy a house or change the beneficiaries on your life insurance, for instance. Following the colonoscopy, we encourage patients to drink plenty of fluids and to eat a healthy meal. We let them know that they may have some cramping and they may need to pass some gas. We encourage that. This is one of the only times that you'll be encouraged to pass gas.
Well, that's all the questions I have set up for you today. I really appreciate you talking with me. Is there anything else that you feel that our folks should know before we end this interview?
So I hope this information helps you to feel more comfortable in undergoing this very important procedure. Remember, colorectal cancer is the third most common cancer among men and women in the United States, and the second leading cause of cancer death among men and women in the United States. Recently, the United States Preventive Task Force recommended lowering the age to begin average risk colorectal cancer screening from 50 years of age to 45 years of age. We are in fact seeing increasing numbers of colorectal cancer cases among younger people. Remember, once you've sailed through your colonoscopy, you have a unique opportunity to share your story with others, such as friends, family, and Twitter followers. Seriously, please be a spokesperson and help us get to our goal of getting everyone over the age of 45 years screened for colorectal cancer.